medical class to know. And start with the neoplasia, with the definition of the neoplasm. ابتعدوا بابا، خلي يصير تباعد قبل الجلوس. And the neoplasm means new growth. New growth. It is a mass of tissue, the growth of which exceeds and is coordinated with the body growth. Then two first criteria important to designate or define the tumor or neoplasm. The growth should exceed أسرع من and is uncoordinated ما له علاقة with the body growth. And this progressive growth continue even after removal of the stimulus that stimulate or evoke the growth. What are the stimuli that evoke the neoplastic growth؟ راح ناخذها بعدين. واضح؟ إذا نبدي من جديد ما دام الجماعة قعدوا من النوم واحنا عدلنا البث مالتنا. بسم الله الرحمن الرحيم. أرحب بكم أجمل ترحيب بأولى محاضرات tumors or neoplasia. وبنعطوا the definition of the neoplasia means the new growth. And the new growth is abnormal mass, the growth of which exceeds and is uncoordinated with the normal body growth. These two important criteria. First two important criteria. This progressive growth continues even after removal of the stimulus which stimulate the growth. What are the stimuli that evokes the neoplastic growth؟ هذه راح ناخذها بعدين. And the third important criteria to define neoplasm is that this growth is purposeless, بدون أي هدف. Any growth, normal growth in the body should have a purpose. There is an aim, physiological aim for the growth, but in neoplastic growth, the neoplastic growth is purposeless. However, some tumors do not form mass. And a good example is leukemia. Leukemia, which is the cancer or malignant proliferation of the blood cells. Okay, and we have localized tumor in the epithelium, which is called carcinoma in situ or intraepithelial neoplasia. راح بعد شوية نعرف شنو معناها. So for any mass to be designated as neoplasm or growth, the growth should exceed and should be uncoordinated with that of the body and should continue after the removal of the stimulus. And there is no purpose for this growth. These are important parameters for the definition of neoplasm. The two basic components of the neoplasms, the parenchyma or the proliferating the tumor cells and the stroma. The parenchyma are the proliferating the tumor cells. The proliferating the tumor cells are it's called the tumor parenchyma. And the supportive stroma include the blood vessels and the connective tissue. Blood vessels, of course, to supply the proliferating the tumor cells with the nutrients and oxygen, while the connective tissue represent or support offers the skeleton on which the proliferating tumor cells are resting, and the الهيكل of the tumor. In some tumors, this connective tissue stroma is scanty, little connective tissue stroma, and so the tumor will feel soft inconsistency. انتزم التيومر بإيده تشوفه soft because the connective tissue stroma is usually the stroma is fibrous stroma, collagenized fibrous stroma. While in other tissue, in other tumors, the stroma is abundant, fibrous, collagenized fibrous stroma, and so the tumor feels hard inconsistency. This abundant collagenous stroma is called desmoplasia. إذا أسوي لها هاي ما تأثر؟ خاف نتحرش بشيء معود. هاي وينها ما راح؟ ده ماكو ما بس ما أعطيك ستوب شيرينج. مو إيه هو الهاي؟ لا 3 كليكس يلا تروح. إيه مع ال 3 جروبس قصدك. أوكي أي have my feet. واضح؟ So desmoplasia means abundant collagenous stroma. This term is important to be kept in your mind. It is important to remember the terms, all the terms will be mentioned in these lectures. Okay? بالمستقبل ما حد راح يقول لك شنو معنى desmoplasia، شنو desmoplastic، راح تسمع هواي pathological reports من تقرأ على tumors. This is desmoplastic, this desmoplastic stroma, or this tumor is desmoplastic. So simply means what? شنو رأيك؟ شو معناها؟ إذا ما تسمع إنه this tumor is desmoplastic. Okay, so it is hard tumor because of the presence of abundant collagenized fibrous stroma. سهلة الشغلة. Basic classification of the tumors into 3 categories. Benign tumors اللي هي الأورام الحميدة, and malignant tumors اللي هي on the other extreme اللي هي الخبيثة, behave aggressively, and these malignant tumors either primary or secondary or metastatic. The tumor at the site of origin is called primary tumor. So primary tumor of the lung, primary tumor of the breast. While when this tumor travels, metastasizes to a distant site, at that site, at the distant site, it is called secondary tumor or metastatic tumor. Okay, so when the primary breast tumor metastasizes, travels to the axillary lymph node. So in the axillary lymph node, it is called secondary or metastatic tumor. Okay. In between, we have the borderline tumors. دائما بكل مجالات الحياة اكو ابيض اكو اسود واكو the gray zone in between. Okay. gray zone الرمادي اللي ما تقدر تقول لا عليه ابيض ولا تقول عليه اسود. وان tumors we have borderline tumors. These borderline tumors are potentially malignant tumors, or they are called the pre-malignant tumors. The behavior is not like a benign tumor and not like a malignant tumor, but when left without treatment, it will behave as malignant tumor. So they are potentially malignant, potentially aggressive tumors, or they are pre-malignant tumors. When left without treatment, the tumor will progress to malignant side. These are called borderline tumors. Okay, so I have three categories: benign, malignant, and borderline tumors. Nomenclature is important. It is important for you to know how to designate each tumor. كل tumor شلون تعطي تسمية مالته. Generally, the tumors either benign or malignant or borderline. And they are either arising from epithelial tissue. What are the epithelial tissues? The surface epithelium, the dermis, or laryngeal mucosa, transitional cell mucosa, or a glandular epithelium. Glandular epithelium like this, sweaty glands, thyroid glands, breast, pancreas, intestinal, gastric mucosa, okay? This is called epithelial tumors. Or it could be mesenchymal tumors, tumors arising from mesenchymal tissue. The mesenchymal tissues, all other tissues, rather than the epithelial, okay? All the non-epithelial tissues, we called it, roughly we called it mesenchymal tumors. So the benign mesenchymal tumors are designated by adding the suffix OMA, which is oma, to the cell of origin. So the benign tumor of the fibroblast, the cell is fibroblast. The benign tumor of fibroblast is called, it is called fibroma, okay? And the benign tumor of the cartilage, what is the cell of cartilage? Chondrocyte, chondrocyte. So you have to add the suffix OMA to the chondrocyte, and it is called chondroma, okay? Site means cell, so remove it. Through parallel origin term, chondroma, symbol. And the benign tumor of the bone, the cell of the bone is osteocyte, so it is osteoma, okay? The smooth muscle tumors, leiomyocyte. So the benign smooth muscle tumor is called leiomyoma. The skeletal muscle cells, rhabdomyocyte. So the benign skeletal muscle tumor is called rhabdomyoma. Okay? Adipose tissue, lipocyte. The benign tumor of the fat, lipocyte, is called lipoma. بعد شنو بالكم؟ Blood vessels. Benign tumors of the blood vessels, heme for blood, and for vessels, angio, hemangioma. Okay? For lymphatic vessels, the benign tumor of lymphatic vessels, lymphangioma. Angio means vessel. Okay? Lymphangioma. The blood vessels, hemangioma. When you say angioma alone, it means hemangioma. واضح؟ ليش طويلة ما أقدر أخليها كلها بالمحاضرة. بس هذه examples عليها. So, this is how to designate the benign mesenchymal tumors. The benign epithelial tumors, we have two types of epithelium. The surface epithelium, good example is the epidermis, okay? And the lining of, squamous lining of the esophagus, squamous lining of the two vocal cords, and the larynx, transitional epithelium lining of the urinary bladder, ureters, urethra, some parts of the urethra, renal pelvis, okay? These are called surface epithelium. And we have the glandular epithelium, which is the epithelium lining the acini and the ducts of the glands. In exocrine glands, we have ducts, and in endocrine glands, no ducts. Okay, and after ارجع شوية على الهيستولوجي والفسيولوجي حتى اذكركم فقط. So generally, the surface epithelial tumors are called papillomas. Papilloma. So when I ask what is papilloma, your answer will be surface epithelial tumor. Is it benign or malignant? Benign, okay? So when one asks what's papilloma, your answer will be benign surface epithelial tumor, okay? And good example is squamous cell papilloma or transitional cell papilloma of the urinary bladder. While the benign glandular epithelial tumors are called adenomas. So when one says, what's adenoma? Your answer will be ما جاوبتني يلا انتم 5 نفرات اليوم اهريكم هاري بالاسئله. قدامك مكتوبه glandular epithelium. Okay, so this is general term. Any benign glandular epithelial tumor is called adenoma. And example, we have thyroid adenoma, which is called follicular adenoma of thyroid. Cells of the thyroid are called follicular epithelial cells تذكروها. All right? Sweaty gland, salivary gland adenoma, breast adenoma. So we have fibrosis, فيسموها fibroadenoma. Pancreas adenoma, gastric adenoma, colonic adenoma. Any glandular epithelial tumor, the benign tumor of glandular epithelium, generally called adenoma. Any site. مثل ما أنت سألت وقلت كل مكان نعم في كل مكان the benign glandular epithelium arises from the acini or from the ducts of the glands نسميها adenoma. The malignant tumors, we have the mesenchymal tumors and the epithelial tumors. Okay, وقلنا all the non-epithelial tumors, generally we call them mesenchymal tissue or mesenchymal tumors. The term sarcoma is a general term used to describe what? شنو ظاهرة قدامك؟ Malignant mesenchymal tumor. Okay? So all the malignant mesenchymal tumors are called sarcoma. And so the malignant mesenchymal tumor of the fibroblast مساء كانت benign سميناها شنو؟ Fibroma. هسه صارت malignant, so what is okay? Fibrosarcoma. كانت when it is benign, it is called fibroma. And it is malignant, we call it fibrosarcoma. Okay? Fibro for the mesenchymal cell and sarcoma for the malignant. Benign tumor of adipose tissue شنو سميناها؟ lipoma benign. When benign it is called قبل شوية شنو سميناها؟ lipoma. Okay? هسه it is malignant, so we called it liposarcoma. Benign blood vessels tumor, we called it hemangioma or angioma, but now when it is malignant, we called it angiosarcoma or hemangiosarcoma. When you say angiosarcoma, so you mean hemangiosarcoma, okay? Not hemangiosarcoma. And the malignant tumor of the lymphatic vessels is called lymphangioma, okay? Angio for the vessels. لا حد يقول lymphoma. Lymphoma is malignant tumor of the lymphoid cells in the tonsil and the lymph nodes and the liver at any site. Okay, so it is not lymphoma, it is lymphangioma. بعد any other example on malignant mesenchymal tumor of the bone, what is called? Osteosarcoma of the cartilage, chondrosarcoma. Okay, so when I ask what's chondrosarcoma, your answer will be malignant tumor of cartilage او chondrocyte. مو مشكله نقول malignant tumor of chondrocyte. Okay, so this is for the malignant mesenchymal tumor. We use the term sarcoma. For the malignant epithelial tumors, we use the term carcinoma. بس أصبح واضح what is sarcoma and what is carcinoma? For the malignant epithelial tumors, we use the carcinoma. Right? And these are examples. Squamous cell carcinoma, transitional cell carcinoma, basal cell carcinoma. إذا هي benign نسميها squamous cell papilloma. ما نسيتوها. Transitional cell papilloma. When they are malignant, we call squamous cell carcinoma or transitional cell carcinoma. ما فهمت. لا يعني انت تقول squamous cell carcinoma of the skin when it is in the skin. Squamous cell carcinoma of the larynx when it arises in the larynx. Squamous cell carcinoma of the esophagus when it arises in the esophagus. Okay. While when the malignant tumor arises in the glandular epithelium, the benign glandular epithelial tumor شنو سميناه مساء؟ ذكروا شوية. adenoma. Okay. While the malignant glandular epithelial tumor is called adenocarcinoma. Adeno for the gland, for the glandular origin, and carcinoma for what? Malignant epithelial tumor. Okay, حسب الألوان. Carcinoma for malignant epithelial tumor and adeno for the glandular origin. Okay, can you give me an example? Any adenocarcinoma in your mind? اسم الله على دماغك. Okay, thyroid adenocarcinoma, any gland حطها ببالك وخلاص. Pituitary adenocarcinoma, pancreatic adenocarcinoma, breast adenocarcinoma, colon adenocarcinoma, uterus adenocarcinoma, gastric adenocarcinoma. Okay, any gland, any glandular tissue, the malignant tumor arises from the glandular tissue is called adenocarcinoma. واضح? These are examples. What gland adenocarcinoma? Salivary, colonic, endometrial adenocarcinoma, and so on. So, it is now clear that sarcoma refers to what? Shown benign, sarcoma, malignant mesenchymal tumor, and carcinoma refers to malignant epithelial tumor, and adenocarcinoma refers to malignant glandular epithelial tumors. Okay, and we have mixed tumors. ليش يصير mixed tumors؟ بعدين من راح ناخذ the carcinogenesis, how the tumor develops. راح نعرف ليش يصير mixed tumors. Okay, so you may see in your practical life there's combination of carcinoma with sarcoma, called carcinosarcoma. Alright? You may find a mixed benign tumors. A good example, which is not a true mixed tumor, but is regarded as mixed tumor, is a pleomorphic salivary tumor or benign mixed tumor or salivary gland. راح تاخذوها بمحاضرات الجي اي تي. صور راح يعطوكم اياها بالفصل الثاني. Okay, and we have the teratoma, which is a true mixed tumor. هسه راح نجي هي بعد شوي. So we have mixed tumors. ممكن أن تكون carcinoma وهي sarcoma or any mixture. However, we have tumors that do not follow these bases of nomenclature. يعني هذه القواعد اللي هسه حكيناها for designation of the tumors نشوف اكو tumors ما تنطبق عليها. And these should be remembered always. For example, glioma. What is a glioma? It's a tumor arising from glial cells. What are the glial cells? وين موجودة glial cells? Brain, okay, the central nervous system, astrocyte, oligodendrocytes, ependymocytes, these are glial cells, okay? So when you say glioma, راح تقول والله دكتور جاسم قال على هالحكي هي benign tumor, okay? But the glioma could be benign, could be malignant. They are graded into 4 grades, grade 1, 2, 3, 4, okay? So grade 3, grade 4 are malignant. حتى لو اسمها glioma. Could be malignant, could be benign. The term lymphoma is always malignant. Malignant proliferation of the lymphoid cells. Malignant tumor of the lymphoreticular tissue in the lymph nodes, in the liver, in the pancreas, in the skin, in any of the skin, أي مكان. Plasmacytoma and the plasma cell myeloma, or the previous term is multiple myeloma. This M myeloma مختصر إلى multiple myeloma. من اسمها plasmacytoma شنو يجي على بالك؟ Benign tumor of plasma cell, but this is not true. Plasmacytoma is malignant tumor of the plasma cells. All the plasmacytomas and plasma cell myelomas or multiple myeloma are malignant tumors and they are not benign. دائما مساء من حكينا قلنا cell of origin وتحط لها او ما وصير benign مو شكلها هيك. Leukemia, which is the malignant neoplasm of the blood cells, all the blood cells, neoplasm تسميها leukemia. Another important example, melanoma. Yes, which is malignant tumor of the melanocytes. وعادة هي تسمى malignant melanoma، ما تنكتب melanoma لوحدها، بس إذا سمعت واحد يقول لك melanoma, so please remember this is a malignant tumor, it is not benign. حتى لو قال لك melanoma لوحدها. Hepatoma, which is old terminology of the liver cell carcinoma or hepatocellular carcinoma. إذا أحد حكى وياك ويقول لك this is a case of hepatoma, so please remember this is a malignant tumor, not benign. Okay, حتى لو اسمه hepatoma. It is carcinoma, it is epithelial, but the WHO classification designates this tumor as malignant melanoma. Okay, so no benign melanoma at all. هذه المتفق عليها بال WHO، هذه الترمينولوجي. Okay, we have seminoma. Seminoma أيضا شكلها يشبه البناين tumor, but seminoma is the malignant tumor of the germ cells in the testes. سميها seminoma. In the ovary we call it dysgerminoma. Okay, so it is a malignant germ cell tumor commonly seen in the testes. It could be seen in any site, يعني other than testes. Rather, its common site is the testes. So when you hear seminoma, This is not benign, it is a malignant tumor. وبعد يجوز اكو examples انا ما جبت على بالي بس هاي كل اللي اتذكرتهم يعني خليتهم بالمحاضره. Okay? So we have tumors that do not follow the previously mentioned basis of nomenclature. احنا بعد بدينا متاخرين ناخذها منكم هاي ال10 دقائق الراحه. مو So we have the term hamartoma. Hamartoma in fact is not a true tumor. بس لأن اسمها يشبه التيومر أنا حبيت أذكرها هسه. Hamartoma is a focal malformation which is composed of tissue elements normally present at the site, at the affected site. And these tissue elements grow in a high proportion, forming a mass. And this mass is called hamartoma. A common example, the important criteria of hamartoma is that the growth of which is coordinating with the rate of the growth of the body. يعني يعطيك history يقول لك هي طلعت من كان صغير وكبرت ويا ما هو يكبر ومن يتوقف النمو مال جسمه هي يتوقف النمو مالتها. اوكي؟ ما قال لك بسرعه كبرت او شيء. نموها بالضبط at the same rate and mode of the growth of the body growth. So it is a tumor or not? Not a tumor, because the tumor should exceed أسرع and is uncoordinated with the body growth. So hamartoma is not a true tumor, it is not a tumor. And hamartoma is simply abnormal formation of normal tissues. The tissues forming the hamartoma are normally found at the affected site. Common example is the nevus, الشامي اللي عندنا. كل واحد بجسمه من وحده الى 100 شامة على الاقل موجود في جسمه. Okay? And this nevus is collection of the hematocytes, of the melanocytes forming a disorganized mass. The melanocytes are normally found in the skin, okay? In the basal layer of the epidermis. Another example, which is rare, is called pulmonary hamartoma or adenochondroma, which is a mass found in the lung, discovered accidentally on imaging, X-ray, CT scan, and it is composed of cartilage, smooth muscles, and glands. All these tissues are normally found in the lung, in the bronchial wall, okay? But they are grow in a high proportion and forming a mass. This is mass called hamartoma. It is not a tumor. They grow at the same rate of the growth of the body. And they stop growing when the body growth is stopped. However, so this is called hamartoma, and we have other examples of hamartoma, like scalp hamartoma. يطلع طفل وعنده scalp mass وتكبر وياه وبعدين تتوقف نموها. Okay, so this is not a tumor. It is not a tumor. In the next lecture راح نشوف the teratoma, and teratoma is a tumor. Okay. اليوم بدينا متأخرين للأسف. بعد عندكم محاضرة بالتسعة هسه؟ إذا عندكم محاضرة بالتسعة لازم نعطيكم 5 دقائق راحة. أوكي؟ يلا شكرا جزيلا. نكمل إن شاء الله يوم الأحد. عندكم سفرة. مو أعطونا خبر الأحد ما راح تكون أكو محاضرات. إذا يوم الاثنين الأسبوع الجاي نبدي نكمل تيراتوما بقية التيومرز الساعة 1 الظهر. أوكي شكرا جزيلا. تاخذوا راحتكم. هذا شكرا. Stop record.